My name is Madeline Kleinfeld. My pronouns are she, her, and I'll be presenting my culminating project on safer and healthier streets for children, the possibilities of street closures in Calgary, Alberta. I recognize that I live, work, and play within the traditional territory of the Treaty 7 peoples, including the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda First Nations, as well as the Métis Nation of Alberta. So here's just a quick agenda. First, I'll give some background info, then I'll dig into street closures and health, and then I'll look at implementation in Calgary. So let's get into the background. I've been fortunate enough to complete my practicum with Sustainable Calgary, one of Calgary's biggest advocates for sustainable travel and active neighborhoods. They're involved in all sorts of sustainability projects, but the project that I have been involved with is their Connaught Open Street. So this is a street closure adjacent to the Connaught School, which was created in collaboration with the children of the school. The children brainstormed ideas to make the street more fun, safe, and inviting, and the team at Sustainable Calgary then took the ideas and developed a pilot, which has been on trial, and now they're exploring options for permanent installation. So with the success of the Open Street, the team wanted to look at the possibility of expanding the program to other sites, which is where I came in. So my job has been to complete a literature review exploring school street closures through a public health lens. On top of this, I had the opportunity to meet with experts and stakeholders, develop surveys, and visit the Connaught site. So why do we need safer and healthier streets for kids? Well, motor vehicles are taking over, and that's not a pretty way of saying it, but it's true. In Canada, we've become increasingly reliant on personal motor vehicles, and nowadays, most children in Canada, and Calgary specifically, are driven to and from school. Importantly, this is not a human fault, but a fault of our system. So our streets and cities continue to be designed for personal vehicles. And the work that I have been involved with focuses on pushing for people-centric design that makes active travel, like walking and wheeling, the easy choice. So let's look at the health side of it. Physical activity is an important aspect of children's overall health, with higher levels being associated with many physical and mental health benefits. Unfortunately, only 30% of Canadian children are meeting federal guidelines for physical activity, and 41% are meeting active travel guidelines. Additionally, exposure to poor air quality during childhood is associated with a host of poor health outcomes, including respiratory conditions, poor regulation, and poor memory. This is alarming as the typical pollution levels during school pickup and drop-off exceed WHO guidelines. Children's short stature in relation to car exhaust pipes also means that they're disproportionately affected by vehicle-related air pollutants, as you can see in this image. Now, safety plays a large part in this too, and traffic injuries are the leading cause of death among children in Canada. Every year, approximately 43 child pedestrians are killed and 3,000 seriously injured. Now, if we bring this image back in, we can see that the child pedestrian is also at increased risk due to the positioning of their vital organs in proportion to the car. Now, on average, collisions involving children occur within 500 meters of schools. Unfortunately, this is not surprising considering the prominence of unsafe driver behaviors and high traffic volumes near schools. It is important to note, though, that unintentional injuries are preventable. And while we can't eliminate human error, we can create conditions where human error is less possible. So how do we do that? How do we create change? Well, we can educate about safe street use, and that's a great tool, but it doesn't make streets safer. It only teaches children to deal with unsafe conditions. We can enforce. Changing speed limits is a great example of this. Or we can actually change the infrastructure or the physical environment. So while my work is focused on the built environment, these other aspects are really important for a holistic view of streets and health. There is evidence to show, though, that child safety issues arising from traffic exposure are most strongly associated with the built environment, which really validates this cause and why this infrastructure angle is so important. So what are school street closures? So we have two different types. First, we have the timed recurring closure. This is thought of as the traditional model. This is the most prominent type of school street closure in Canada. These closures typically operate for 30 to 60 minutes at pickup and drop-off times, and they're usually patrolled by volunteers and enforced through movable barriers and signage. Next, we have long-term closures, which are much less common than the timed recurring closure model. However, they have been cited as a hopeful way forward in reducing volunteer reliance and impacting greater societal change. These closures vary in their implementation, but typically involve the semi-permanent or permanent pedestrianization of a school street. In other words, making them car-free. So this photo depicts a permanent closure in Paris where they have actually replaced the pavement and planted greenery. However, semi-permanent closures like the current Cannot Open Street in Calgary use things like cement barriers and planters. So let's look at the health impacts of these closures. Safer streets are a clear benefit of school street closures. Lower traffic volume is not only objectively associated with less pedestrian injuries, but subjectively associated with higher safety perception. UK researchers found that streets nearby school street closures almost always had a reduction in traffic. And evidence from Ontario pilots also found around a 60% reduction in traffic on nearby streets. Now, by reducing traffic, safety perception also increases, and that hasn't been extensively researched, but Ontario pilots, there was a 44 to 74% increase in safety perception upon implementation, which brings me to the next benefit, independent mobility. So this refers to a child's freedom to move around and explore their community without adult supervision. It provides opportunities to gain confidence, autonomy, decision-making skills, as well as overall health benefits. The built environment and parental perceptions are key factors in children's ability to engage in independent mobility, and school street closures are ideal because they can target both. But while independent mobility is consistently cited as a benefit of school street closures, it hasn't really been explicitly studied. Now, as I mentioned, vehicle-related pollution near schools is a huge issue, and closures could help. So data from Ontario shows a 42 to 65% reduction in pollutants during interventions. A UK analysis at 18 sites also found inconsistent results, but their most significant comparison yielded a 34% reduction in pollutants. Again, this database is pretty limited and could use further investigation. School street closures are globally recognized as a way to increase active school travel. In line with this, all Canadian school street closures that measured active travel found increased rates, with the most significant changes occurring during the interventions and slight increases remaining post-pilot. So in childhood, social connection is associated with improved behavioral and mental health outcomes. As well, children also benefit when their parents have favorable social connections. So interventions like this that provide opportunities for parents and children to connect are ideal in shaping healthy children. The development of school street closure initiatives also requires collaboration and community buy-in, which can strengthen the presence of community connections. They also create a space for members of the school community to gather and connect. In fact, many of the Ontario closures resulted in parents and children meeting others in the school community for the first time. Now, children are more susceptible to heat-related illnesses due to quicker heat absorption and poor body temperature regulation, and long-term closures can reduce surface heat by increasing green space. This can ultimately reduce the urban heat island effect, which is essentially the overheating of urban areas caused by insufficient greenery and heat-absorbent materials like dark pavement. So let's take a look at implementation in Calgary. So why is this important for Calgary in particular? Well, Calgary is one of the fastest growing cities in Canada, and our population is quite young, with nearly 20% being ages 0 to 14. Calgary also has a great history of travel strategies, and beginning in 2016, the need for safer school streets becomes really prevalent. So here we switched all of our school zones and playground zones into one unified zone that operates for the same times every day of the year. This quickly resulted in less pedestrian injuries and better adherence. So the Active and Safe Routes to School program was initiated in 2019, and today 52 schools have school travel plans because of the program. Moving into 2020, we get 2 updated planning documents that contain policies regarding sustainable travel and pedestrian safety. And then in 2022, we get the 5A network, which focuses on the city's pathway connectivity, and a large portion of their funding has been allocated to infrastructure near schools. We also get the neighborhood streets policy, which advocates for children's mobility and fun street environments. And then finally, in June of 2024, the city is committed to having in-street crosswalk signs at all schools that include grade 6 and below. Interestingly, though, these signs do not significantly change the number of motorists or active travelers, which signifies a need for further interventions targeted at active travel and traffic reduction. School street closures could be a great strategy to fill this gap. So at the end of the day, this is a great reminder that our everyday spaces really impact our health. Now, it's a bit more complex than healthy spaces equal healthy people, but developing spaces that make healthy choices easy, accessible, and equitable is really at the heart of it. My work focused on Calgary, but what could your area look like if healthy spaces were prioritized? What about the whole of Canada or the world? I just want to thank the team at Sustainable Calgary, Celia, Noel, David, Sirmal, and Fran, along with everybody else I've had the pleasure of connecting with through Sustainable Calgary. Everybody has shared such unique insights on this project, which has translated into a really well-rounded report. And I feel like I've only skimmed the surface, so I would really encourage you to read my report, and I'm happy to send that out to anybody who reaches out. Thank you.